At the moment, one of the problems we have is that we have too many patients for too little space at Golisano Children's Hospital. We share operating rooms with the adult surgical services.
So first of all, the reason there's a wait currently is because when we opened this incredible building several years ago, the number of surgeries we were doing was a small percentage of what we're doing now. And so the point we're at now, we are doing almost as many, if not more, pediatric surgeries as adult surgeries in the operating rooms that we share with our neighbors at HealthPark. And so what that's doing is that's just creating an increased wait time for our patients in the community that require elective procedures or outpatient procedures.
HealthPark, along with its neonatal ICU, its high-risk obstetrical services, and its cardiac surgery program, and the sickest of the sick general surgery adult population, every day those operating rooms are running 24/7. And we are trying to compete with those services with all of our children's services. But as there's more and more children, more and more specialists delivering care to children, we've just run out of room. Having a pediatric outpatient surgery center will allow quicker access to higher quality care. There are certain conditions, in my discipline, for instance, in orthopedics, fractures need to be taken care of in a timely fashion. If we can get to them in a reasonably quick time frame, not that they're emergencies, but they're urgent, then we can get better outcomes for families.
So I think it was October 28th, my son was playing basketball, went up for a shot, I think they call it a layup, and then he came down and he was on the floor. And as a parent, to see your kid, who is the kid who's never on the floor, he's the one racing up and down with the ball, to see him on the floor in pain, holding his knee was a really bad day. We had an MRI, and it turned out that he had a fracture of the patella, fracture of the tibial tuberosity, and the patellar tendon was torn off.
Well, I was in bed for most of the time because I couldn't walk, and I would wake up some mornings absolutely hurting, and I was annoyed and really wanted surgery. But after, I felt a lot better, and I feel like if it happened the day after that, I feel like I would have had less pain.
And we had that surgery about 3 weeks after the injury, and thank God we were able to get in because the surgery schedule was very full. And after the surgery, Dr. Shannon did feel he would make a full recovery, and thank God he did. He's back playing basketball. And there's so much need. If you come to the waiting room, it's always filled. And I know that was a concern with us, getting on the surgery schedule and keeping him healthy to make that appointment. So being able to have a surgery center just devoted for outpatient surgery, that would help our town. We're growing so much. As a parent, I think that's a wonderful thing to be able to help create a hospital, an outpatient surgery center where children can get surgery sooner rather than later.
So in our discipline, we might perform surgery on the hand and surgery on the foot at the same time. Or more importantly, we might team up with different disciplines. I recently did a procedure with one of our pediatric urologists. So that child has one anesthetic, which minimizes any excessive risk. And we did the orthopedic procedure and the urologic procedure under the same anesthesia.
At his appointment, Dr. Shannon said it was okay for him to get his screws removed 4 months after surgery. So that would have been April 15th. So we were so excited to get on the surgery schedule.
25 years ago, when Children's Hospital of Southwest Florida was on the second floor, and there was no Golisano Children's Hospital, it was no big deal because the population was small. But as the years have gone by, and we've been able to grow as a community, we don't have the same capability to take care of all those children who need our services. So the concept of an ambulatory surgery center serves kids who don't need to be hospitalized.
So we actually, a pretty large percentage of our surgeries done here in the hospital currently are outpatient procedures, which means they don't require an admission to the hospital after they have their surgery performed. when our team sat down and started to discuss solutions for the increase in volume we were seeing here, and we realized that only about 800 of our kids coming in for surgery in the hospital required an admission to the hospital. And so it didn't make sense to build more operating rooms here in the hospital. What made sense is to build them at an outpatient center where these kids can have access in the time they need it.
Right now, at this point in my career, the hardest part about pediatric surgery, especially outpatient surgery for kids, is scheduling. It's not performance of the operation. The hardest part is scheduling. So if we had a pediatric surgery center, it would make getting these kids efficiently into a surgery center, getting quality health care at much reduced cost. I mean, that would be the biggest benefit to me, would be the scheduling aspect.
Well, as a parent, when your kid is sick or when your kid is hurting or when your kid needs surgery, that's all you think about.
Without donor dollars, without the amazing giving folks in our community that have given so much already to Golisano, the surgery center, it won't be possible. We will not be able to expand and meet the surgical needs of the kids in this community without their support.